So we're going to be showcasing the Leadership Matters. We're going to be looking at basically how we've developed the programme. We're going to look at some of the partners that we've worked with and basically how we've developed it. And we're going to look at it in the way with regards to a particular theory called Simon Sinek's Golden Circle. So we're going to start off with the why and then move slowly on to the how and what. Okay, so with regards to the why, we're going to focus on some of these areas. With regards to the King's Fund, there was a report that was pulled out in 2011 called No More Heroes. And that identified change that needed to happen in leadership, and it worked towards a bit more of a distributed model. So it looked at the way we need to change distributed model. It focused on behaviours and leadership behaviours in particular, which Matt will focus on in a short little while, and the individual leadership behaviours that managers need to kind of focus on as well. As part of that, our staff survey highlighted the need to focus on support and the skills that managers need to have, and basically we also looked at how the DIG-BQ the DIG-BQ strategy also looks at how the Leadership Matters is going to focus on our strategy, so how we're going to build, grow, innovate, develop, and how we're going to promote quality within the organisation. Of which the staff capability element is one of our HR directors, Chris Oakes, one of his key kind of incentives. So that's the reason why it was designed, and the focus is on that particular area there. So it's basically looking at some of the key areas of HR. It's looking at HR skills around recruitment, sickness, all sorts of different things. And then it's making those foundation modules a priority, and there's also engaging modules as well, which are around high-level management people skills.
Learning and Development have been here today to talk about the Leadership Matters journey that we've been on, not only as a team, but also within the organisation.
As Laura says, it was around us making sure that managers in particular understood what their core priority, and leaders what their core priorities were, and the key tasks that are involved in being a leader or a manager within NHFT. And how we achieved that, initially it was working with various different corporate services and understanding what the needs from HR, from quality, from recruitment, and the programme management office to identify what were the key skills from those perspectives that leaders and managers needed to know about being able to deliver their roles effectively. And we work with subject matter experts in each of these areas with those departments across the organisation, but also with subject matter experts externally to the organisation where specialist skills and knowledge were required. All of the modules were piloted and launched trust-wide from September 2016, and we worked with the communications team to share the message, and there is now a page on the staff room as well as part of that has information on all of those, all of the modules and the programme overall. We've continued to learn and adapt the programme, and based on the needs of the organisation, but also based on feedback from people who've attended modules over the last sort of 9 months or so. For example, feedback from the new appraisal module, the new appraisal paperwork, the leadership behaviours came back, that actually there was a desire from staff to focus a lot more on actually the paperwork and what the leadership behaviours were and meant. So we've changed the design of that session so that it focuses very, very clearly on what it is the paperwork looks like, how to complete it well, and then looking at the skills that are required, the questions that you can build into that as part of it.
The programme itself is offering leadership development for staff within the organisation, and that could be from senior management, deputy director, and staff also who want to progress into a leadership role. It's been really important that we ensure that leaders have the appropriate skills and knowledge to carry out their roles effectively, to enable that staff feel supported, and this is one of the key elements that's been focused on themes throughout the staff survey, that sometimes that isn't actually happening enough, and what we want to do is to enable the leaders to actually have that emphasis on actually it's supportive and take staff on a journey with them within the organisation.
We've also been collecting feedback from immediately after, but also making sure that we've got 3 months afterwards. How have people embedded this? How have people put this into practice as part of their everyday tasks? What's the relevance to it? So just thought I'm being rushed on now already. So in terms of what what makes it innovative and different? The programme's been designed using brain-based learning principles, and it's based on engaging learners in the learning environment, and as you can see with the visuals and things like that, it's very much central to that. But they also have an opportunity to embed learning through doing. So whether it's writing a performance improvement plan as part of the capability module, actually what does that look like? What does a high quality performance plan look like? Or whether it's role playing as part of the return to work interviews with some of our psychology partners now, colleagues now are coming in and doing role play activities as a member of staff with managers and giving feedback on how they felt as a member of staff in that interview with a manager. And a crucial part of that is actually that feedback element and making sure that people feel more comfortable in giving and receiving feedback from somebody. You know, what's it like to be on the receiving end of you is a really powerful question, I think. And throughout all these programs, we're embedding the leadership matters, the leadership behaviours that are crucial as part of this to sharing that. But also the programme is bespoke to NHFT. It focuses on key core behaviours, but also the research that's based within NHFT. So for example, managing sickness module focuses very heavily on managing mental health sickness, because that is in the organisation our highest cause of sickness, and that's something that we need to address as part of that to support the health and well-being of our staff. So our time's running out. Just over the course of the rest of today, this is going to be up on the wall. Each of the tabs around the outside are bits of feedback that we've had from people who've attended the programme under 4 different categories: actions they're willing to take, feedback, general feedback, any key learning points, and any changes they recommend, because it is the feedback that we get from staff who attend that is helping to embed and improve the programme that we deliver. So do take the opportunity to have a look at some of those.